Aloha, everyone. I trust you are choosing to express a kindness to another person today. Welcome to Dr. P's Facets of Life series of pods. This is pod number 40. Today's topic, life after a cardiac event or surgery. Although you have been through and may still be going through a very difficult, if not traumatizing experience, you need to know that the times that lie ahead are full of hope and good news where your cardiac health is concerned. Because treatment options continue to improve, outcomes are better than ever when appropriate recommended treatment and rehabilitation programs are adhered to. As cardiac patients, and I happen to be one of you, I have been a member of the Zipper Club for over 10 years. We need to work to overcome some personal stressors such as loss of hope, loss of control, and any sense of isolation we might have. It is extremely important to become captain of our own treatment team. In order to minimize daily struggles that you and your family might encounter while making daunting decisions, it is critically important to have effective support and resource teams in place to buffer against the possible trauma of diagnosis, treatment, surgery, and procedures, as well as to help navigate the many choices in every aspect of this potential life-transforming health issue. Be sure that you are comfortable and confident with the plan that your healthcare team is recommending. Once this is the case, then remember that communication is the basis for clear understanding and positive commitment. Be assertive. Make any questions you have specific and brief. If something is confusing, try repeating it back to the doctor in this manner. Hey doc, do you mean I should? Be actively involved with your healthcare team as much as you possibly can. You know, there are numerous health issues that can develop for any number of reasons that are not always related to lifestyle. Because the heart is so critically important to the function of all organs and the entire body, proper treatment and lifelong adherence to appropriate heart health maintenance must be achieved. It is important for you to realize and frequently remind yourself that you are the same person you were before your event or procedure. It is also important to understand that your condition may change your life. Some things might actually be better than before because some diagnosed conditions can bring certain gifts that were unexpected that affect your quality of life. These gifts can be things like a more positive perspective on the way you value life itself, or an overall better physical quality of life. Admittedly, it is possible that some potential changes might be viewed by you as less positive. Only time will tell. Regardless, the sooner you can accept whatever change occurs, the sooner you can make adjustments that will allow you to participate more fully in managing your illness, your condition, and your recovery. In discussing treatments, recommendations and protocols vary based on the underlying condition or conditions. Some treatments can be relatively simple, such as lifestyle change, with or without medication. Other treatments may involve minimally invasive procedures and/or medications. Now, after a surgical procedure, a typical treatment plan will involve exercise, nutrition, and lifestyle changes, coupled with preventative medications to deal with issues such as cholesterol, blood pressure, and overall heart function. Every person's experience with treatment symptoms and side effects is unique to that individual. Being aware of what might occur can help reassure you that certain experiences are normal. As a result of this awareness, you will be better prepared to deal with what you experience. Being well informed may also help you and your doctor prevent or proactively manage side effects so that they won't disrupt your treatment and recovery track and won't decrease your quality of life. Whatever physical or emotional changes that might occur, don't make any assumptions about them. Ask your doctor or healthcare team member about what you are experiencing at any given time. Many of us experience unusual emotional feelings, such as mood swings, tearfulness, vulnerability, fragility, and more. This can be normal as long as it does not interfere with everyday functioning over a long period of time. If you feel as though you are on a track toward depression, say, alert your doctor before it gets worse. He will assess or refer you as deemed appropriate. It takes time to accept the consequences of some treatment, surgery, and rehabilitation, and it takes time to understand what it will mean for both you and your family. Everyone's level of acceptance and level of coping abilities differ and may vary over time as well. So be patient with yourself and be patient with the process as it evolves and improves. If you happen to be fortunate enough to have close, loving caregivers, communicate and connect with them every step of the way. Allow them to give their gift of love and caring to help you. The better your support system, the better the odds of a better prognosis. Use that support to motivate you to do all that you can to facilitate progress and recovery. Finally, let's talk a little bit about wellness. A good diet is especially important during any illness because the body requires nutrients to maintain our systems, our strength, and our healing ability. It is important to maintain a steady and healthy body weight throughout treatment and recovery. This means neither gaining nor losing too much weight. A cardiac rehabilitation program can assist you with information about the types of foods that are best suited to your treatment program and to your adjusted lifestyle. It is not unusual, depending on your particular problem and treatment, to lose strength and become deconditioned as a result of your specific illness, procedure, surgery, and treatment, regardless of your previous level of fitness. Fatigue, pain, and the emotional adjustments that may accompany major changes in your body may also take a toll. Active, regular participation in your rehab program will help immensely in a good outcome and recovery. Although there may be times when you feel a little unenthusiastic, kick yourself in the butt, be grateful for what you have, and keep on trucking. Remember that I've been down this road before, and I understand how you may be feeling. You can do this. That's it for this time, folks. Remember that gratitude is the best attitude. This is Dr. P saying aloha.